My name's Lucy Leonard. I'm an occupational therapist and I work with the OT service. I'm going to be talking about the principles of posture management. The posture is the position of the body parts in relation to one another and in relation to the environment. Posture management is looking at techniques to maintain and support a good posture over time. And posture management should be done over 24 hours. The average adult in the UK spends around 9.5 hours a day sitting down and around 8 hours a night lying down. So it's really important that we look at posture in those positions, seated and lying. And there's a lot of information and a lot of training out there around sitting and lying. So for example, people who they work in an office, there's a lot of information around display screen equipment and sitting at desks and ergonomics. And similarly, there's a lot of information about lying down. But we have to think about posture throughout the 24-hour period and what different activities people are involved with over that time. Posture is affected by different aspects of the human body. So it's affected by breathing, and breathing's really important. So we need to be looking at somebody's breathing when they're seated or when they're lying. We also need to look at their circulation, which is movement of fluids around the body. And we also need to take into account pressure care. That's really, really important. So whatever somebody's doing, we need to look at the amount of pressure that is being created on the different parts of the body. So if somebody is, for example, struggling with their breathing because of poor posture, that can lead to lack of oxygen moving around the body, which can then have a negative effect on cognition because of brain hypoxia, and could also lead to damage with the organs. And this is something that can happen really slowly and over time. So it's absolutely essential that we're looking at posture in whatever activity that the person's involved in. Posture is really important to facilitate, to allow people to engage in their daily occupations. So occupations are the things that people want to do, need to do, or are expected to do as part of their life role. So posture is really important to help people to facilitate them in their everyday lives. And human beings are naturally social creatures. We are social animals. So when we're engaging with other people, whether that's part of a family or whether it's in the school or part of a community, we need to assess and look at posture to allow people to get involved in the activities that are really important to them. So other examples of where it's important to look at posture is things like at meal times. So when a person is engaging with the rest of their family at mealtime, can they look at their family? Can they engage with eye contact, because they might not be able to speak verbally, but it's really important for somebody to feel part of a family group. And then if we think about something like bathing is so much more than just about getting a wash. It can be used as a way to relax, and actually for children, it can be a really good way to facilitate play and also to communicate with carers and parents. So when we're thinking about bathing, it's really important to look at the posture of a child or of an adult and to think about whether they can make eye contact and really engage with their carer during that activity. Thank you.